CDX2 as a prognostic biomarker in stage 2 and stage 3 colon cancer, presented by Aislinn Alvarez Rendon, teacher Dr. John Moscoso. First definition. The CDX2 protein can identify a small subgroup of patients with stage 2 colorectal cancer who are likely to benefit from adjuvant chemotherapy, say researchers. Use of CDX2 as a prognostic biomarker for these patients may be more predictive than clinical stagings, which typically guide treatment decisions in these patients.
The usefulness of adjuvant chemotherapy after surgery for stage 2 colon cancer is unclear. It appears that many patients are treated to benefit a few, given our inability to identify which patients are at greatest risk of relapse. Delurba and colleagues designed a study aimed at identifying those patients. They used microarray-based multi-gene expression signatures to identify biomarkers of epithelial differentiation. The search identified 16 candidate genes. Of these, one encoded for a transcription factor, CDX2, whose expression levels were lower in more immature cancers and could also be studied with a clinical-grade diagnostic test. The study identified a small population of colon cancers, about 4%, that lacked CDX2 expression. The authors then evaluated the association between CDX2 expression and disease-free survival using immunohistochemical analysis of tissue microarrays. As compared with CDX2 positive tumors, CDX2 negative tumors were associated with lower rates of 5-year disease-free survival, overall survival, and disease-specific survival. But in a large pooled database of prospective randomized adjuvant therapy trials in which CDX2 expression was not assessed at the time of treatment, patients with stage 2 CDX2 negative tumors who were treated with adjuvant chemotherapy had improved 5-year disease-free survival. CDX2 positive disease, on the other hand, was unaffected by adjuvant chemotherapy. Preliminary testing in patients with stage 3 disease also suggested a strong association between adjuvant chemotherapy and improved disease-free survival in those with CDX2 negative tumors. The authors conclude that a lack of CDX2 expression identifies a subset of patients with high-risk disease who appear to benefit from adjuvant chemotherapy, and they advocate that these findings be confirmed in clinical trials. Full study results are available at nejm.org.
Application in medicine. CDX2 is understood to manage cells differentiation within the layer of cells that line the colon. Wherever the cancer begins, patients whose tumors lacked CDX2 expressions had a deficient prognosis compared to those whose tumors scored positive for CDX2 expressions. Results indicate that patients with stage 2 or stage 3 CDX2 negative colon cancer might benefit from adjuvant chemotherapy, and that adjuvant chemotherapy might be a treatment option for patients with stage 2 CDX2 negative disease who are commonly treated with surgery alone. Cons. The downside is that an easy way to single out these patients before they relapse is still not known, and are unable to predict accurately who may gain advantage from post-surgical or adjuvant chemotherapy. Applied in Ecuador, we assembled a large database of gene expressions, arrayed experiments involving human colorectal cancers, and searches for genes with differential expression, defined by Boolean relationships with respect to a well-established differential marker across the patient population. Conclusion. CDX2 is a very exciting advancement in the identification of biomarker in stage 2 colon cancer. It not only identifies prognosis of patients for potential relapse, but also predicts benefit of adjuvant chemotherapy in patients at high risk for relapse.
So many of the patients, of course, are concerned what their prognosis is. Now, there are different ways to evaluate the prognosis of patients. The most important, of course, is the staging of disease. Obviously, if you have stage 1 disease, a very small tumor removed, your prognosis is excellent and all patients basically are cured. But if the tumors get bigger or involve lymph nodes, the prognosis decreases. We are now using different treatment options to improve the outcome with adjuvant chemotherapy.